Tell me a little bit about the route you've taken as a medical doctor, where you started to where you are now, and why.
Well, I did traditional medicine for a lot of years, and I got frustrated that it seemed not to be helping, that there weren't really the answers there that I was looking for. And repeatedly using medication, adding more and more and more medication, and not really seeing the results that I was looking for. So then I started to look at, you can call it holistic or complementary or different kinds of options that let me look at different things and come up with finding why these things were happening. Why did kids have recurrent ear infections? Why did illnesses seem to keep escalating even though you're trying to do something about it? So I went into more natural approaches, which helped. I used homeopathy, I used vibrational medicine, and then it was like a point of awakening. I realized years ago that emotion had a lot to do with it. And then I started learning about the law of attraction, and that really started to change my thinking again, taking me to a different place again from where I had been.
What do you feel now, your treatment plans? Do you feel that they've really changed since you've, in all of your beliefs?
Well, yeah, they have. There are basic things that you can put in place to help the physical body. But until you really address the emotional, the thoughts, the feelings, the beliefs that a person has, you can't really get them to where they want to be.
What about the children? You are a board-certified pediatrician. You see just as many adults as you do children, but what about the children and their belief systems, especially those that can't communicate with all the autism that you work with?
Well, to me, those children are not broken. They don't have something wrong. It's a choice they have made for a reason. And to me, those kids came here to teach us unconditional love and acceptance of difference. And that it is that contrast that puts the eternalness in eternity. It is that contrast that helps us decide what it is we want and don't want.
And working with them and helping them at least feel differently? Is that
what
is your work with them then?
Well, then the real work with them is to have them not be in pain, not to be in discomfort, but to be comfortable. And then accepting them for who they really are, not for who everybody thinks they are.